I am here today at the Breast Centre, Llandochau Hospital near Cardiff to visit the people that are working tirelessly to help many men and women in their fight against breast cancer. We are lucky to have a strong network of supporters to help us fundraise, but we want to show past and new supporters firsthand how much donations really make a difference in aiding this charity. I am here today at the Breast Centre Llandochau with fantastic Mr. Sumit Goyle, who is a founder of the Breast Centre over a decade ago. Lovely to see you. How are you?
Lovely to see you, Justine.
It is fantastic to be here. So tell me a little bit more about this facility.
Like you said, Justine, we a decade ago we were in our breast services were at the Heath Hospital, and they were quite fragmented. So we conceived the idea of the Breast Centre mainly to provide a service all under one roof. We have taken into account what the patients wanted, what the staff wanted, and built this facility. This facility provides a one-stop shop for the patients who have breast problems. By that I mean the patients who come here are seen by the consultant, have all their investigations done all in one day, and 95% can go home on the same day knowing what's wrong or not wrong with them. What we have also done, especially with charity money, is to provide something more. And what we do more is things like bra fitting services, exercise prescription, which we'll have a look at in a minute. We provide pamper evening for our patients, complementary therapies, we provide tattooing services, we provide teaching training facilities. So all that is in big part from the charity money.
So what you're saying is you provide here a very personal service to all the women. So it goes over and above what you would generally have in another venue.
This room, Justine, is our live reporting room. So what happens here is that as the patients have their mammograms, they're reported here. So our consultant radiologists sit here and they report it live. So in the old system, patients used to have a mammogram done earlier. They had to wait 2 weeks before they could be seen. But now it's all done live. It takes longer, but it's so much more convenient for the patients. And that is what this purpose-built unit has given us, the ability to do a one-stop clinic for our patients.
Fantastic. So I'm here with Donna Egbia and we're in the Multidisciplinary Room. Now this room has been totally charity funded. How much of an impact has this had on the work that you do here?
Well, this room's really important. It gets used every week for our multidisciplinary meeting, and we hold that with a number of different clinicians from different hospitals, and they're able to come in through using the audio-visual equipment. We're able to display people's mammograms and any information that's important about those patients, so that the patient is at the centre of any discussion. So this room's really important for those meetings. It's also used for education of staff, of new doctors that we have, trainees, medical students, and also nursing staff, and it's been used for GP education. Also we've used it for the patients, so when the patients come and they have what's called a moving forward appointment, this room's been used for that, and we've used it for body confidence sessions as well. So it's a really great resource, and we're very grateful to have such a really dedicated room which is kept up to date through charity funding.
So all the rooms up here and the facilities, this is all charity money?
Yes, Justine. So all this part where we were just now, our multi-purpose room and the room we are going in now, and all this area was all built by charity money. We spent £250,000 building it. Wow. All raised by our volunteers and our events.
That's incredible, isn't it?
Yes, it's
£250,000 just.
And that actually is exactly what we were talking before, has made the difference, that extra mile, and that's what it's done.
So let's have a look in this one.
Yes, let's go in.
So This looks like a really great room. You've got exercise going on here,
Yeah.
which is obviously something that must be so great. Lots of different machines. You've got sort of cross trainers, you've got treadmills, you've got weights, and lots of things going on here. How does this benefit the men and women that are fighting the battle of breast cancer?
Well, that's a really good question, and we know that people who are active and do exercise are much more likely to have good outcomes from their breast cancer, and I think that's really important. But it's also about empowering those patients who are going through a really tough time, and actually this gives them a bit of control. And that's really important for not only physical well-being but also mental well-being, and we're here to help encourage those people to do more activity and to give themselves the best chance possible.
It is always an absolute privilege to spend the day with the wonderful team here at the Breast Centre Llandoch, and to experience just how much your donations really make a difference in helping the team and the women that come here for the treatment. The consultants, nurses and the rest of the team work so hard to make sure that everyone comes here feels comfortable and they're not alone in their fight against breast cancer. Your extra money and your donations have made this centre over and above what the NHS can offer, and without you none of this would be possible. So from everyone here at the Breast Centre Llandoch Hospital, thank you so much.